All right, a new flu variant has been adding to an early and very busy flu season, particularly in Asia, Australia, and Europe. And the U.S. could be next in line for a more severe outbreak. The first week after Thanksgiving, the number of people going to their doctors for flu-like symptoms rose to 3.2%. Disease experts say that's above a national baseline that they call the epidemic threshold. It's a signal that flu season is officially underway. The FDA is working on a plan to put its most serious health warning on COVID-19 vaccines. The so-called black box warning is prominently displayed on medication labeling. It's meant to alert healthcare providers and patients about serious risks, such as death or disabling reactions that should be weighed against the potential benefits of a drug. The Department of Health and Human Services says that any news about a warning label is just speculation right now. Dr. Lipi is an internal medicine physician, and she's joining us right now. The FDA has not confirmed that they will be adding these warnings, but do you think it's necessary? Is it a good idea?
Oh, first of all, Fredricka, great to see you. Sorry about this cold climate, but this is a good reason to talk about COVID because we're going to be seeing a rise in respiratory illnesses during this time of the year. And look, just so the audience is clear, black box warning is basically, it's designed to convey the most serious risk associated with a medication, a substance. So like benzodiazepines, Xanax, it would say high risk of addiction. Ibuprofen, high risk of serious GI bleeding. With COVID-19 vaccines, the current FDA leadership is trying to make this connection between the COVID vaccines, particularly the mRNA technology ones, with a supposed risk of a pregnancy, safety risk with pregnancy and children's safety and deaths. The thing is that there is really no evidence for that. We don't know what data they have. I think they're going by VAERS, which is the Vaccine Adverse Event Reporting System data. But I mean, anyone can report something. Like I can report a rash after I took acetaminophen, Tylenol, but it has to be investigated. There have to be scientists and researchers investigating that. What data does the FDA have? What research have they done? What clinical data do they have? So that's my concern right now, Fredricka, and that's the concern of most public health professionals and scientists. There's no data, and this is not surprising, to be honest, Fredricka, because back in August, the HHS released a report saying that they are winding down mRNA technology vaccine development. So this is kind of consistent with the frankly misinformation that HHS, starting with RFK, have been putting out for many, many months, sadly, Fredricka.
Okay. Dr. Lipi, great to hear from you. Thank you so much.